Hypothalamus artificial intelligence. Digital transformation powered by real-time autonomous and intelligent algorithms. Presents its solutions for Pandemic Management Decision Support System. Part 1. Pandemic Management using Advanced Artificial Intelligence. The presentation consists of 5 videos, and their supporting documents, which summarize all the applied research work carried out by HI, to contribute its knowledge in highly complex mathematical modeling, to the optimized management of pandemics such as COVID-19. These are: Pandemic Management using Advanced Artificial Intelligence, Epidemic Simulation Model, General Epidemic Optimization Model, Epidemic Economic Impact Model, and Kalman Filter Estimation Model of the Epidemic State. The models corresponding to Part 4 and 5 are designed, but have not been implemented. Hypothalamus Artificial Intelligence thanks the support received from Tecnológico Nacional de México, who partially financed the implementation of the CIMER/RS and CERM/RS/OPT models. Specifically, HI thanks the staff of the Instituto Tecnológico de Ciudad Madero, who actively participated in the project, and was the way to receive this support. Users of these mathematical models can be grouped into information technology companies, government, universities and research centers, and private enterprises and gremial organizations. The result of the research and mathematical models carried out by Hypothalamus Artificial Intelligence, it is considered a public good, because it is of benefit to all humanity. Therefore, HI is willing to offer them at no cost to nonprofit organizations, mainly in developing countries. HI is also interested in being part of research groups working on pandemic management. Conference prepared and edited by Jesus Velasquez Bermudez. His resume can be found on LinkedIn. A different paradigm for epidemic management. As Albert Einstein put it, to raise new questions, new possibilities, to regard old problems from a new angle, requires creative imagination and marks real advance in science. A new paradigm for epidemic management. The management of a pandemic based on traditional control policies, mainly on epidemiological criteria, without considering the future socio-economic impact, does not seem to be indicated in the era of Industry 4.0. Which stands out for the great ability to project the future, to make the best decisions, using the computing power derived from computational technologies, and the exponential advance of the ability to model high complex systems. Therefore, it is required a different paradigm for the modern epidemic management. Ignoring in the management of the pandemic in the short term, the long-term socio-economics effects, is the most serious mistake that can be made. While it seems that the ethical thing to do is to defend a short-term life, it is also true that it is ethically wrong to condemn millions of lives to poverty and hunger in the future. This duality is not easy to solve. The socio-economic model is aimed at determining the socio-economic impact of epidemic management at level of each region of a macro region. Balancing decision-making between two contradictory objectives, minimizing the number of deaths in the short term, conjunctural decisions, and maximizing in the long term the population's quality of life indices, structural decisions. It is a multi-criteria optimization model. Artificial brains, the decision support systems in the Industry 4.0. The artificial brains corresponds to the scientific foundations, more specifically mathematical fundamentals, that allow to connect multiple mathematical models, algorithms or robots, exchanging information between them to obtain a common goal, and act as holistic intelligence of the organizations, or parts therein. Like the human brain, the artificial brain is composed of the following artificial components: neocortex, hypothalamus, and hippocampus. The artificial brain is the evolution of DSS under the Industry 4.0 revolution, that is conceptualized as a set of mathematical models, that exchange autonomously information between them, working online, using distributed optimization. When all the models that make up a company are solved using the concepts of real-time distributed optimization, an artificial hypothalamus is obtained. In the case of the epidemic, HI has conceptualized the epidemic management hypothalamus based on 4 models: epidemic model, logistic model, economic model, and control and surveillance model. This video is related with the logistic model, oriented to optimize the use of health resources. The support of the hypothalamus is its information system, which is common to all mathematical models. This is how the human brain faces reality, using multiple models of reality, acting permanently in parallel, to make decisions. The algorithm that simulates the hypothalamus is assembled by Optex, the HI's cognitive robot, using the models that traditionally make up a decision support system. The current state involves the integration of edge computing and cloud computing to implement highly complex mathematical models. Pandemics, regional planning, disaster management, and homeland security. The pandemics of the future. COVID-19 will not be the last pandemic humanity has to face. Infectious diseases remain a danger that threatens all countries. Every outbreak, wherever it arises, can become a pandemic. For this reason, the United Nations has requested, on more than one occasion, increased investments to improve surveillance, early detection, and rapid response plans of all countries, especially the most vulnerable. 2 years after the start of the pandemic, COVID-19 was still causing about 50,000 deaths per week. Until the end of December 2021, it had caused more than 276 million infections and 5.3 million deaths. Part of the solution is related to physical facilities, as it must strengthen local primary health care systems to prevent them from collapsing. Ensure that all people have access to vaccines, on equitable terms, and achieve universal health coverage. This will inevitably involve expenses that many countries are not able to make, to significantly reduce the impact of the pandemic, on all fronts, mainly public health, economy, and quality of the human life. Then, it is essential to foster global solidarity so that all countries can stop the spread of infectious diseases as soon as they detect a dangerous outbreak. Mathematics and pandemics. Given the rapid growth of artificial intelligence, in all its mathematical methodologies, artificial neural nets, support vector machines, advanced probabilistic methods, mathematical programming, and others, this alternative cannot be ignored to improve the management of future pandemics. We must learn from the current pandemic, so that in the short term, it is possible to face pandemics, not only with large direct investments, and unimaginable social and economic consequences. Discriminating between the loss of a human life, and the hunger of people of scarce resources, and the return to the past of many societies, will always be an ethical dilemma, very difficult to solve. But it will be more difficult, as long as the artificial intelligence that humanity has created is not used intensively to protect public health. The experience of COVID-19 allows us to affirm that humanity was not prepared to use its maximum power to face the problem that arose in December 2019. That is why, in many countries, health authorities made their decisions based on obsolete methodologies, perhaps typical of the 1918 Spanish flu pandemic. Using in 2020, mathematical models with few differential equations, to explain the behavior of the pandemic in conurbated regions, with several million inhabitants, with multiple socioeconomic characteristics, does not agree with the level of artificial intelligence used in real commercial activities. Disaster and emergency management. Sun Tzu, in the book The Art of War said, "Every battle is won before it is fought." To face the disasters, planning supported by the scientific method can avoid conflicts, deaths, and damages, so that many battles are won without a fight, or its negative consequences are limited, thanks to scientific planning. The challenge. Develop a DSS for disaster and emergency management. The overall objective is to minimize potential negative economic impact and human life losses. The solution. Design a set of mathematical models to address the problems arising from disaster management based on stochastic programming models. The benefit. A set of measures and mathematical models to prevent and/or reduce the impact of disasters, and it prepares the community to respond in the best way when a disaster strikes. Actions before mitigation, set of measures to prevent or reduce the impact of disasters. Preparedness, preparing the community to best respond when disaster strikes. Actions after reaction, The use of resources and emergency procedures to preserve the life, property and environment of the community, since the disaster is occurring. Recovery, set of long-term actions to stabilize the community and return to normalcy. The mitigation and preparation of disasters caused by nature implies. The overall objective is to minimize the potential economic and human loss, and continuity of operation of the economic system. To this end, the historical behavior of nature is studied, trying to know probabilistically what can happen in order to make decisions of where, when and how to allocate resources to mitigate or prepare for the disaster. For disasters caused by the humans it implies. The overall objective is to minimize the potential economic and human loss, and the social impact of the terrorist attack. To do this, models are proposed that study the opponent and hypothesize the decisions that can be made, using game theory models, on where, when and how to allocate defense resources. The reaction and recovery after the disaster occurs implies actions during the disaster, and reconstruction actions. Pandemics have always been attributed to reasons controlled by nature. These will be increasingly dangerous due to the evolutionary capacity of viruses, and the agglomerations of people derived from population growth, mainly in those regions in which birth control has not changed the growth trend, to a pattern of population decrease. However, there is also the possibility that the pandemic will be triggered, because of an act of terrorism, controlled by humans. Pandemics generated by new viruses, such as COVID-19, entail an additional problem, which is the lack of knowledge about the behavior of the virus. This makes the problem more complex, since, simultaneously, the health authorities must face the problem of discovering the behavior of the virus, and making decisions about a process that is not known. Activities to ensure safety. These mission areas may be grouped based on when a defensive action is intended to occur, either before, during, or after an attack. Proactive planning, mission areas whose defensive actions are taken before an attack occurs. These mission areas are prevention/protection, and mitigation. Real-time operational planning, mission areas whose required actions are taken during or immediately after an attack. These mission areas are detection and response. Recovery planning, mission areas whose required actions occur after an attack. This mission area is recovery. The use of advanced mathematical tools is not new to disaster management. There are many systems implemented to protect society. This is the facing a war is, perhaps, the closest thing to facing a pandemic. In general terms, a war is a latent danger, which can occur at any time, in which the surprise factor is part of the key to success. Start to preparing for war, the moment war begins, is heartbreaking, and presumably the premonition of a long-lasting disaster. Having a fixed pre-established combat plan is usually the consequence of not having analyzed the possible scenarios. Analyzing the possible scenarios requires mathematical models that can analyze complex situations. Technologically, that is possible due to modernity. Once in action, participants must have the ability to adapt quickly to each new situation, and at the same time action plans perhaps never thought of. For example, a bacteriophage virus could be the solution, not the cause, of the next pandemic. The decision-making during the pandemic process aims to make the best decision for society, which is not easy, nor intuitive. The problem is further complicated, when decisions must be made with real constraints on available resources, and when it must consider the socio-economic impact, derived from the pandemic and its control. Simple but wrong, it is not an option, because the equivocation during the management of the pandemic is an error that can become a horror. Complex but right within the complex there are more options, suddenly the road can be narrow and long, but safe. The traditional goal of pandemic management focuses on modifying the natural behavior of the pandemic, solid curve, through sanitary controls, in order to reduce the peak of infected people, striped curve, and thus save lives by reducing the deficit of hospital resource capacity. However, it should be noted that the two curves have the same integral, and in theory when time tends to infinity, the amount of the infected population will be equal. If hospital resources are sufficient, there is no reason to delay the peak, and as the pandemic spreads, the negative socioeconomic impact will be greater. The traditional tool is to use simple epidemic simulation models, trying to predict the future of the pandemic, under different control measures, and thus select, based on human perception, which is the best decision. When all the models that make up a company are solved using the concepts of real-time distributed optimization, an artificial hypothalamus is obtained. In the case of the epidemic, Hai has conceptualized the epidemic management hypothalamus based on 4 models: epidemic model, logistic model, economic model, and control and surveillance model. The artificial hypothalamus of a pandemic decision support system is conceived by Hai, based on a multi-layered mathematical model, which expands as the scope of decisions it must support grows. The layers considered are supported in the following models: epidemic simulation, control policies, system capacity expansion and management, and socioeconomic impact. The result must be multiple dashboards that indicate the planning status of the pandemic. For a holistic view of the process, impacts should be visualized on the epidemic, the health resources, the micro-macro economy, and the optimal strategy to face the epidemic. This holistic vision allows the authorities responsible for public health to visualize the general quantitative impact of the pandemic, and not only limit themselves to the simulation and try to control it with decisions based on mental models, which in complex situations have been proven not to be the most indicated, and in many cases counterproductive. Economic and social added value by mathematical methodologies. The analytics landscape diagram presents IBM's vision regarding the value added by the different methodologies that integrate analytics, or artificial intelligence. Not all methodologies produce the same ability to handle complexity and achieve competitive advantage. This cannot be ignored by public health officials, as the absence of adequate mathematical methodologies translates into greater negative impacts, deaths and loss of quality of life. The simulation models, traditionally used to make decisions to control the pandemic, correspond to tools of low mathematical complexity. This is because simulation models do not have an optimization capability, and leave the decision in the hands of the human expert. In this way, the expert tests multiple scenarios, and in a finite time, selects the one he considers the best decision. On the other hand, optimization models iterate internally at the calculation speed of the host computer, and based on strict mathematical laws, if time permits, they will come to propose the best decision that can be made, according to the decision-maker criteria. The difference between the two decisions will simply mean fewer deaths, or lives saved by highly complex mathematical methodologies. From the point of view of disaster management, the actions to be taken are: before the mitigation implies, develop and maintain the mathematical models and their support database, and training of professionals who will manage the pandemic, through simulations of potential pandemics. The preparedness implies, preparing the community to make the best respond when pandemic strikes. After the reaction implies, use of mathematical models to dynamically manage the pandemic, making decisions as the catastrophic event unfolds. The recovery implies, use the mathematical models, to the extent that they are useful, to support the recovery of the economy, and adjust mathematical models according to lived experiences. To do nothing in the period before the pandemic, is to let nature make the decisions for us. Anticipation. It is the core of decision-making under Environment 4.0. It is not a question of reconstructing the damage caused by a disaster, with decisions a posteriori. It is about anticipating and mitigating with actions before the disaster. And the best way to do that is to use the mathematical modeling power under the new technological paradigm. CIMER RSOPT model has been published in the special edition of the European Scientific Journal, Public Policies in Times of Pandemics. The document, CIMER RS. General Model of Simulation of Epidemics, Multi-Infected States, Multi-Socio-Demographic Segments, Multi-Region Mobility. Theory, corresponds to the model of differential equations for the simulation of pandemic processes. The document, CIMER RSOPT. Epidemic Management Optimization Model, Control Policies, vital health resources, and vaccination. Theory corresponds to the optimization model, which integrate the differential equations model for the optimal management of pandemic processes. Hypothalamus artificial intelligence. Invites to join to the LinkedIn group. Mathematical modeling for coronavirus pandemic. Like Herbert Simon, Hypothalamus AI believes that the computer-based mathematical modeling is the greatest invention of all times. Thank you for your attention.